What equipment is needed for sputum smear TB diagnosis? Imagine trying to catch a tiny bacteria that hides in your lungs. To do this, health workers need specific tools to collect and examine sputum samples safely and accurately. First, they use sterile specimen containers. These special containers keep the sputum sample pure and prevent contamination during transport. It is very important that these containers are approved for medical use and are sealed tightly. Next, gloves are essential. Healthcare workers wear gloves to protect themselves from any bacteria in the sputum. They also wear masks called N95 respirators. These masks filter out small particles in the air, helping prevent inhaling infectious aerosols during collection and processing. When preparing to look at the bacteria under a microscope, the lab needs clean glass slides. These slides must be new and never reused to avoid any mix-up or contamination. To spread the sputum evenly on the slide, staff use wooden applicator sticks or similar tools. Once the sputum is on the slide, it is air-dried. Then, the slide is fixed by passing it through a flame or heat source, like a Bunsen burner. This step helps the bacteria stick to the slide and prepares it for staining. Staining reagents are also required. These chemicals, such as Ziehl-Neelsen stain or fluorescent stains, make the bacteria visible under the microscope. The stain slides are examined with a light microscope, which can be a bright field or fluorescence type. The microscope must be properly maintained to identify acid-fast bacilli, the bacteria that cause tuberculosis. In some cases, sputum induction is needed if a patient cannot produce sputum naturally. For this, a handheld nebulizer with 3% saline solution and a mouthpiece is used to help the patient cough up sputum. During all these steps, a well-ventilated workspace is recommended. Good airflow or extraction fans help reduce the risk of aerosol exposure, especially if a biosafety cabinet is not available. The entire process involves collecting sputum in sterile containers, preparing thin smears on slides with applicator sticks, air drying, fixing with heat, staining, and then examining under the microscope. Staff must wear personal protective equipment like gloves and masks to stay safe. Following these guidelines ensures the process aligns with World Health Organization and CDC standards for safe and effective tuberculosis diagnosis. This method is simple and low cost, making it accessible in many countries, though it is less sensitive than newer tests. So, in summary, the key equipment includes sterile containers, gloves, masks, slides, applicator sticks, staining chemicals, a microscope, and a heat source, all used in a clean, ventilated environment to keep everyone safe and get accurate results. Always remember, proper training and safety procedures are vital for reliable diagnosis and protection.